Good afternoon, everyone. Welcome, welcome. My name is Angela Davis-Stokes. I am the Manager of Provider Training and Development at CBH, and I am honored and pleased to introduce you today to Ken Carr from Open Minds. He will be talking this afternoon about creating a technology-first approach to service delivery. So, Ken, I will hand it off to you to begin our presentation for today.
Thank you, Angela, and welcome to everyone. Today we want to talk a bit about technology and integrating it into our services, not just using technology as a tool, but how do we integrate it to provide better services, engage the consumers we're serving, and create some competitive advantage, because we know that other providers out there, large providers, other providers in the community, are integrating this technology in a way that meets consumer needs. So today I want to focus in particular on the EHR and the role of the EHR today versus how we've used that in the past. I want to talk a bit about the hybrid service delivery model. How do we have a delivery model that integrates both face-to-face services, as we're used to doing, and telehealth, but does it in a way that meets consumers' needs and adapts to our clinical protocols. And then the last area, we want to talk a little bit about consumer experience and engagement, which is really key in terms of how now we ensure that we're providing the best services possible. So, when we think about a digital first approach, we're talking about digital transformation, which really is that integration of technology into all areas of how we provide our service. We're not just using it for billing purposes or documentation purposes, but we're utilizing technology throughout the entire service process. And there are a couple of questions I think we should all ask as we begin to assess where we're at with technology and where we need to go in our organization. What does our tech infrastructure need to be successful in this changing workforce environment of delivering services? So, we know that there are new opportunities. We know that what we've done in the past may not meet the needs a year from now or 2 years ago. So what do we need to add to our tech infrastructure? And what's our transformation going to look like? What do we need to do in our particular organization with a focus on primarily consumers we're serving, but also payers? So I want to talk today from a particular framework. This is the Open Minds approach to how do you create a tech platform that prepares you moving into this next normal. It takes everything that's happening, all those trends that are moving within our service market, everything from value to changes in how competitors are providing services, takes what's happened through the pandemic and begins to help us build a tech platform that prepares us for the future. And there are a couple of aspects of a tech platform that we need to be thinking about. One aspect is how we're going to integrate our data and how we're going to use that data, analyze it, get it out into the hands of clinicians and supervisors and leaders in the organization so we can make better decisions. So one part of technology is about how do we gather everything we're doing in data elements, convert that information, and then make it useful, actually change what we're doing because of what we're learning. So it impacts our decision making. The other aspect of that is how can we really provide better services? We talk about service performance optimization. Optimization is about maybe doing things more efficiently, but also doing things with better results. So we're impacting our quality. So as we look at our tech structure, we're looking at those two big approaches to how we want to make better services or provide better services moving forward. And so there are some aspects of that. And of course, if we use data for decision making and we're optimizing our services, it does create a certain competitive advantage. We know that the service market in which we work, behavioral health, intellectual developmental disabilities, autism support services, substance use treatment. We know that's all becoming very competitive. And so how do we position ourselves with the right technology to remain an essential provider in our area? So, if you jump down to kind of the bottom part of this slide, there are two key drivers that I think are important as we look at our technology. One is, how will our technology support value-based, risk-based reimbursement and contracting? And so, with that perspective, we need to make sure that if we enter into a contract to deliver certain outcomes, maybe it's pay for performance, so we're driving specific outcomes, that we're aligning our data, we're aligning the information that we're sharing with our staff around those data outcomes so that we can achieve them. So, our platform, our tech platform really needs to be able to capture what we've contracted for and what we'll ultimately be reimbursed for. We need to be able to measure value. We need to be able to assess our risk. And so what tools are we building into our technology so we can assess our risk? That may have to do with some population health management as well. Having tools where we understand, of all the consumers we're serving, which have the most intensive needs, which consumers maybe we need to bring some more resources and service to bear, or bring them into a more intensive service for a period of time. So our technology helps us better understand where our consumers are at and adapt our service provision based upon those needs, ultimately ending up with better results. And so that ties into the whole concept of how are we going to drive value and how are we going to contract for value. And the other side of that is looking at how are we going to integrate our systems. So not only do we need to be thinking about the electronic health record, and we're going to do a bit of a deep dive into that in a couple of minutes, but we need to think in terms of our human resources information system. So what are we gathering on our staff, and how is that supporting not just our ability to do payroll, to meet our workforce regulations, that type of thing, but how does our integrated system help us understand issues of productivity? How does it assist us with the training that staff need, not just to provide services, but to provide some engagement in our organization? And so having an integrated human resources and general ledger system contributes to that. Everything from recruiting and being a part of our recruitment platform to talent management, so our ability to make sure people are getting the training they need, to managing of credentialing going back into our EHR so that we can assure that when a consumer has a particular need, we're assuring that we're bringing a clinician with the right credentials to that individual. And all the way down to schedule management, shift bidding. We've talked in a previous presentation about this whole workforce issue and the flexibility that we now need in order to manage our workforce, which then impacts our ability to drive services and have adequate staff to do that, adequate talent at various clinical levels. So integrating that HRIS system along with our finance system and our EHR becomes very key. If we look a little bit, and we're going to do a deeper dive, as I say, into our electronic health record system, but just some of those key points: does need to be mobile. More and more services will be delivered in the community. And so what does it take to be mobile, user optimized? I just did a SWOT analysis with an organization a couple of weeks ago. And one of the big factors that came out in our internal analysis with staff was that the EHR was difficult to work with. And so, that indicated to us there really needs to be some optimization. It doesn't mean they need to go out and purchase a new EHR, but they do need to take a step back, look at the functionality, look at how the system is integrated with protocols because it needs to be user optimized. Interoperable, so we need to be able to share information, especially in a quality environment. So we're sharing information, we're doing some care coordination, and we need to do some automated consumer assessment, some measurement-based care, some decision support. So we need these extra tools in our EHR. When we look at the hybrid service delivery platform, we're thinking, of course, of telehealth, but we're also thinking about secure text. So how can a consumer that we're working with be able to reach out to us in a secure manner when needed? And how can the consumer have more engagement by being self-directed in their communication interaction with us? We're talking about home-based services. So we send a staff person out in the community. How can we verify that they're at that location and how long they were at that location? We use tools such as electronic visit verification. We want to make sure that staff are utilizing route optimization. It keeps the cost down. It makes their time more efficient along the way. We're looking at issues like remote monitoring. So if we have home-based services, perhaps with individuals with intellectual and developmental disabilities, maybe we're able to do more with remote monitoring, which creates a higher level of self-sufficiency, but also reduces the need for staffing. And that ties into the whole concept of a smart home. Open Minds just today in our Circle article talked a bit about the concept in an organization called LAD down in North Carolina that has really implemented some smart homes and is taking remote monitoring to a new level with their consumers. And it needs to also be integrated. So when we think of our hybrid service, we need to integrate what we're doing so that our protocols identify, is this best delivered in person, face-to-face, or via some mode of telehealth or virtual. And then thinking in terms of the consumer experience and engagement platform, really want to think about the new consumer. We often talk about, what Amazon has done to all of us as consumers, right? I tend to go to brick and mortar stores less and less because what I have need to purchase, I can typically find on Amazon. And not only can I find it on there, there are multiple options. I can assess my options based upon consumer scoring. There may be 5,000 or 6,000 or 7,000 people who have bought this item, and I can look at how many stars it's gotten overall. I can look at those who are unhappy with that service. And so we have changed as a society in terms of how we purchase anything, including our healthcare. So when I'm looking for a doctor, I'm going to go online and I'm going to read the ratings about this doctor. I'm going to get more insight before I even reach out. I'm much more educated now than I was 5 years ago in choosing my provider. And it's the same for our consumers, especially as we move forward in terms of even diversifying our income. If we are able to enter into a commercial contract with a payer in addition to some of our Medicaid related contracts, we have to focus more and more about how do we become the provider of choice. And so we now have to think about our website. Is it optimized for someone? Is it just a number of slides or screens with static pictures, or is it optimized that I can quickly bounce around? Is it optimized that I need services as a consumer and I can go to your website and be able to fill out a form requesting a referral saying I need services, and that's going to immediately go to someone. So how is your website set up? How are you utilizing social media, both internally and externally? Data portal is really big. And that same SWOT analysis that I talked about, one of the concerns of the providers was that we just don't have a very good portal. We aren't serving our consumers with the access they need to their data, to wellness data, to their ability to schedule an appointment or to even pay their bills. And so, looking at that, looking at smartphones and app connectivity, and that being a part of how we engage consumers. Maybe it's tied to our EHR. Maybe it just is integrated in some way. Consumer decision support. So we want our individuals that we're serving to be able to make decisions. So how can I support some of that decision making? And then let's get as many health and wellness tools into the hands of folks as we can. So just want to talk a little bit through the remainder of our presentation on some of these issues that really, I think, impact our ability to build an integrated technology-first approach to the services we provide. Every year, Open Minds at our Technology and Informatics Institute presents a survey. We survey organizations across the country about their technology. It really started a number of years ago around their EHR in particular, but it's expanded even beyond that. So we want to understand, and so we'll survey a large number of organizations who are specialty providers around mental health and substance use treatment and autism and intellectual and developmental disabilities. So we really want to understand where are folks at, what are their needs, what are they implementing. And in our latest survey that we released last fall, we identified what are the top 10 technologies most frequently adopted by specialty provider organizations. The top one, of course, was the electronic health record. 88% of the providers said we have implemented an EHR. And the surprising thing about that to me is that it's not 100%. And I know a lot of smaller providers have opted not to implement their own EHR. Maybe they're using some billing software, something that helps them to document and bill, but it's not a comprehensive EHR. But as we will see as we move through the presentation today, an EHR, if we move beyond that first generation level, has so much to offer in terms of how a clinician can provide better service and how consumers can engage in those services. It's no surprise that the second most frequently adopted technology was telehealth and remote therapy at 85%. That was driven primarily over the last 2 years because of the pandemic. And if we look at telehealth in particular, we know, based upon the statistics, other surveys that have been done, the biggest user of telehealth overall is in the area of individuals wanting behavioral health treatment. And so that really becomes a key way that we can be providing our services. Interestingly, and there was a big increase from 2020 to 2021 in referral tracking, having a referral tracking system or database. Often that's integrated into the EHR, but sometimes it's standalone. At 21% increase, which indicates a lot of what's happening in terms of how we're engaging consumers and referral sources. Having that process integrated into our website, integrated into our EHR is very key. So those are the top three, and as you can see, health information exchange is key, and then there were a number of other technologies as well that folks were really beginning to adopt and integrate into their systems. But one of the questions we often ask providers as well is, how much have you optimized your EHR? So of all the functionality available to you in your EHR, how much of that have you actually implemented so you can optimize that investment that you've made? Going back to 2016, you see that those who said they had fully implemented their EHR, it was running around 69%, and that slowly increased through 2018. It dropped in 2019. There really was a bump up in 2020, but for our survey in 2021, that drop down significantly. And there may be a number of reasons for that. It may be a number of organizations were seeing the need to integrate a new EHR into their organization, and so they hadn't fully optimized or integrated all the functionality of that particular software. But we digging down into some of those reasons, when we ask folks, why haven't you fully implemented your EHR? About 20%, 19% said that as they have implemented overall, other agency priorities or initiatives have taken priority. So, that can be a driver, which I think the lesson for us is once we begin to implement an EHR, it's really important to have a goal of full implementation in a set period of time. I've worked with organizations where we wanted to get that EHR, that new EHR in, and get the basic functionality in place, wanted to get the billing running right away, get clinicians trained on that core functionality, with the anticipation that we would go back and integrate the rest of the functionality at a later time. It's always hard to do that after the fact. And so from the very beginning, understanding what your implementation schedule is going to be, when you're going to bring each area of functionality in, is really key. Looking at statistics around how long does it on average take to implement a new EHR when you purchase it and begin that implementation overall. Most organizations take about a year for that. Now, you might get some of the initial functionality in the first 3 to 6 months. I worked with an organization where within 6 weeks, we were able to begin billing for some of our programs. But I think planning on a year to make sure all functionality in place is key. Other reasons for not fully implementing, both delays from our internal organization and or from our EHR vendor, so about 19%. Delays from just that vendor, about 18%. Internally, delays from our internal organization, about 11%. And once again, understanding that the cost of an EHR isn't just what we pay in terms of dollars, it's what we set aside in terms of staff time for integration is really key, and carving that out is important. But I think it's interesting that the largest reason for not implementing full functionality was that the functionality is not equal to what was needed. And so that really does get back to this question of assessing what EHR we need, what functionality we need. If we've got a current EHR and there's some functionality that isn't there, what's our process for working with the vendor to get that created and in there? If we're having that need for functionality, others are too. Or even assessing, if I'm going to get a new EHR, what should I be ensuring is involved there? I think, having a very systematic approach to creating your RFP, identifying your needs for your EHR, really key. Asking questions around training and implementation and data support, even beyond what's the current functionality, how are you going to support ensuring that we have future functionality, because we know that our market and our needs are changing rapidly. So how can you help us stay ahead of those functionalities? How configurable is this system going to be? Am I able to write the reports that I need to? Can my staff pull the data out in an ad hoc fashion in a very easy way, so they don't have to be SQL programmers in order to do that? Are there business intelligence tools that can be integrated or already integrated so that I can get the data into the hands and become data driven from the standpoint of my clinicians and my staff? Are there data exchange capabilities? We talk about integration. So all of these things come into play when we're looking at functionality, not just currently, but in the future. So when we look at some of those functionality needs as well, The highest need of functionality in the EHR was around patient engagement and the client portal, followed closely by the need for mobile. I think that this does speak to how the landscape of our service provision is changing and how our needs as a provider organizations to stay competitive and meet these changing consumer needs line up. And so, I think the market is really driving the need for functionality. We think in terms of mobile. I actually sat in on an EHR presentation a couple of days ago, and what was emphasized around mobile was we don't always, when we send our clinicians into the field, have access to the internet. I currently live in a rural part of the country where in my home, I've been able to get very fast, high-speed internet. But the moment I step outside into the community, it's very hard for me to get reliable internet on my cell phone. And so, when we send our clinicians out and we think in terms of mobile functionality of an EHR, that disconnected functionality is really key. Having your mobile device be able to record your documentation. We've talked also about how we can utilize artificial intelligence to take that documentation so that when I come back and I connect with the EHR, I can very easily and efficiently document what I did in the field in the consumer's home. Value-based care measurement and reporting is really key in analytics. And when we talk about value-based care, that key concept that we come back to is, do I have the data that I need to drive the results that we know are going to deliver value? And so having that capability to both capture the data, report the data so that we can act upon it is key. And then electronic visit verification, that's related to the whole mobile concept, and telehealth virtual care, so that being able to support that. Integrated primary care, I think, is very important. When we talk about value, we talk about the trend of integration, whether we're providing some form of primary care, or we're contracting with that, or we're partnering around that, our ability to, within our EHR, capture some of that data becomes important. And so as you look at functionality of your current EHR or a future EHR, that becomes very big. And then, just looking then around medical homes, CCBHCs, our ability to coordinate data to provide whole health in an integrated manner becomes important. So I've talked about moving beyond that first generation EHR. And so when I kind of think about that functionality, when we assess our current EHR and our needs moving forward, we've talked a little bit about integration, optimizing that consumer experience, value-based care, support, and then hybrid. And so, this quote from the VP and head of platform for Google Cloud, think of digital transformation, and this applies to provider organizations as much as it does to Google. Think of it as less a technology project to be finished. So we've gotten our EHR and we've got it implemented, as a state of perpetual agility, always ready to evolve for whatever customers want next. And so there's this change in our mindset. It creates a change in our culture as providers around integrating technology. We talked a little bit already about this moving beyond the first generation EHR. And if we go back, I probably implemented my first EHR 15 years ago, and it really all was about documentation that met regulations and being able to turn that documentation into billing. And even before that, we built our own EHR, which are always about just capturing clinical documentation, the basics, into a database so that we could put it into an electronic file and bill. And so we talk about those first generation EHRs, they met some regulatory requirements, they helped us bill. When the government began to set up some requirements around HIPAA and data sharing, it made sure we met those regulations as well. It used to be called meaningful use, and so that was a big part a few years ago of what we wanted to make sure our EHR could do. But now our EHR needs to provide competitive advantage. It needs to enable us to deliver services the way consumers want them delivered. Mobile, we've talked about. User optimized, we've talked about that as well. And user optimization has to do not just with efficiency, but with our engagement with our own staff. And so from a workforce standpoint, we want our EHR to be optimized so it reduces frustration on the part of staff. It supports what they're doing, doesn't become an obstacle. Interoperability is important. We talk about value, we talk about care coordination. So our ability to have an integrated system across primary care. If we're not delivering primary care, how are we getting that information into our system? Behavioral pharmacy, pharmacy and labs. So do you support e-prescribing? How about e-labs? Do you have a social database where you can be doing referrals and receiving referrals as well? The functionality to store and deploy consumer assessment data. So are you able to online enable your consumers to fill out the assessment? So before they even come in and see the clinician, they filled out the demographic paperwork, they filled out a number of assessments. The clinician is prepared to make that time face-to-face, whether that's in a virtual manner or in the office, as efficient as possible, and have that assessment data tied into some sort of a decision support tool for the clinician. That's going to drive more consistent outcomes. And then consumer-facing accessibility of or ownership of the record, the electronic health record. So on the physical side, I can go into my electronic health record. I have my password and login. I can go in, I can see the notes the doctor's put in there. I can request a prescription. If I have a concern, I went in to see the primary care doctor and they made a mistake in terms of my weight. They added 100 pounds to my weight, and they got the wrong blood pressure. It measured they recorded much higher than it was, which made it appear that I had two chronic conditions. I can go in and I can get that corrected. And so, our ability with our records, and we've often in behavioral health been very careful not to share some of that data with the folks that we serve. But, moving forward, having consumer-facing accessibility is really key in our EHR. The integration piece we've talked about as well. And integration really comes into play in terms of that revenue cycle. So is your revenue cycle optimized? What you're pulling from your EHR and being able to send out in terms of billing, putting that into your financial system, integrating that with the reporting, that's important. The automated recruiting and talent credentialing is key as well. Actually, there are some EHRs that are beginning to actually integrate that HRIS system because our needs with talent management around credentialing, around creating this integrated system are so important. Talent management, that has to do with your ability to make sure that staff are receiving the training they need to at the time they need to receive it. So integrating your learning development system into your EHR, having that integration is going to be very key. It also supports staff desire to move up in their career, to receive other training. Centralized scheduling management, shift bidding, so the ability to fill shifts through your HRIS and ensure that that data is getting in an integrated way into your overall scheduling of consumers. And then just from a reporting standpoint, having all of that data tied together is key. Looking at the optimized consumer experience and engagement platform, and we'll dig a little deeper into this in a couple of minutes, but you really want to be able to have the self-service information. A consumer should be able to do some self-scheduling, be able to go on and see from my clinician, when are some openings when I could actually schedule. I can do that with my primary care doctor. I can do that with my physical health specialists. We need to be able to have that self-scheduling opportunity. Transparency of fee schedules. If a consumer has a copay of some sort, their ability to know that and to know kind of what's the cost of this service to me is important to have available through that patient portal. Billing and financial information. How much might I owe? How can I pay? Can I pay online if I have a small copay that's been unpaid up to this point in time? And then communication. How can I integrate communication? Some secure texting and messaging. There may be a separate platform. I saw a EHR the other day where they had a secure texting platform that all of that data was actually captured and put into the EHR. And then we also touched briefly earlier about those consumer decision support tools. So are there some diagnostic algorithms based upon the information we're seeing in assessments? Are there some engagement tools that we can work with consumers to implement? We'll look at a couple of those options in a moment. And then overall well-being and management tools. So, do we have maybe an optimized portal with information around this particular consumer's needs, and not just behavioral health needs, maybe some of their chronic conditions. How can I control my blood pressure? How can I work to have better health overall and manage my weight and exercise and overall well-being? All of the information really coming from that portal being loaded into the EHR. Value-based risk reimbursement platform. A key one there is that population health management tool. So do you have the ability to look at the population of folks you're serving, understand those who have higher needs or are having changing needs so that you can use that population health data to get the individuals into the right intervention at the right time, and maybe move them down to a less intensive service when they are at the right point. But your ability to use that data and analyze it to better deliver the right level of service at the right time. Value management and financial risk functionality, value measurement in particular. So if you got a fee for service type of contract where you are earning additional or pay for performance, and you're earning additional payment based upon certain outcomes, you want to be able to have that built into your EHR so that I, as a clinician, can understand what is important for me to be doing at what time frame and documenting, because ultimately we're going to receive payment on that because that's what we've contracted for. And even some predictive software built into that EHR. Hybrid service delivery model, talking about virtual. So how does my EHR support that telehealth that can be done, or that secure text? I mentioned a moment ago how one vendor that I saw the other day is able to just take all that data and download that into the EHR. And a number of other approaches. And the key is that we want our EHR to provide the basis for our other technology. So it's all in one place. It's easy to utilize by our staff. So it's going to increase productivity. It's going to help our clinicians work at the top of their license, which is going to bring better engagement on their part as well as efficiency for our organization, and it's going to result in better engagement overall. May require some re-engineering. And when we talk about that functionality piece, one of the challenges that organizations have is they have their EHR with its processes, and then they have their old procedures and workflows, and they never fully integrate, they never gain the fullest impact that they could. And so there's some re-engineering that we do, not just when we implement the EHR, but even as we move along and we understand how we can utilize it better. And so taking that data, utilizing that to drive better outcomes. I want to talk for a couple minutes about the hybrid service delivery platform, and then we'll end up our conversation today by looking at consumer engagement, some tools that are being used as well there. So, when we talk about the hybrid service delivery platform in particular, we know that there have been a number of drivers for that. We've talked about that along the way. The biggest driver, of course, being that consumers are much more open to it now than they were 2 years ago, because they got used to how to use hybrid when they were moving through the pandemic. So we have these definitions here, face-to-face, that's how we traditionally have delivered services in person. And the thing about face-to-face services that have created some challenges as we moved into hybrid is that when we schedule an appointment with someone, we are there. We can say, okay, this appointment is for 30 minutes, or this is a 50-minute psychotherapy session. So, how we deliver the service is impacted by how we have to document and bill for it. And so there's a certain rigidity that has been built into, in particular, our fee-for-service approach to service delivery. When we move into virtual, we're seeing models that are much more flexible. Maybe it is a 50-minute psychotherapy session, but maybe it's more of an opportunity where it's just a short 10-minute connect with folks using telehealth. And so our ability to fully utilize the flexibility of a virtual approach has been limited a bit by some of the billing codes and the like. And so as we move forward, kind of need to be thinking about how can we take the virtual and get the best value out of that, but in addition, move into a hybrid approach where sometimes we meet face-to-face. Sometimes we need to sit down with someone for a 50-minute psychotherapy session. And at other times, maybe we need just a quick virtual connect. And so building a system that understands, two things, what's the consumer's preference? And secondly, what's the best way of delivering a service for the most, the best outcomes or quality outcomes in the end? And so those are the two considerations we need to think about. We already talked about the fact that, during the pandemic, first quarter of the pandemic, 80% of behavioral health visits, approximately 70% of primary care visits were virtual. I think primary care virtual has dropped a bit over the last 6 months or so, but we still see this as a primary way that behavioral health visits are delivered. So when you think about how do you look at your plan for hybrid services, while there are many specifics about the next normal, we do know that successful provider organizations are going to have some hybrid approach. And so this does become not just a competitive consideration, but also one where we're really adapting to what consumers prefer. We talked about change in services, how the innovation cycle, we talked about that in the last session. This is an example of the innovation cycle. Consumer expectations have changed. We're all in this position of moving into a hybrid environment. So, some of the things to think about, and even as we work with payers, we look to influence regulations. Hybrid models may include less rigid service definitions. And we're seeing payers beginning to change those definitions. We're seeing Medicaid in a number of states beginning to adapt to how virtual can happen more effectively. When we think about this hybrid approach, we're not just talking about face-to-face via camera. We're not talking about just telehealth. We're talking about texting. We're talking about email. We're talking about the consumer communicating through the portal. And we're looking at asynchronous care. So, I may not be looking at from the standpoint of, here's my 50-minute psychotherapy session, but I may connect for 5 minutes or 10 minutes and come back and then follow up at a later time later in that day. And so, this asynchronous care begins to be a part of how we deliver those services. And hopefully, as we move forward, aligning some of our alternate payment methods will create more flexibility. So, the hybrid service model versus virtual, home-based, integrated, talked about a number of these technologies, right, that can align as we move into that hybrid approach. This is all about identifying, what are the subpopulations that can benefit best, maybe from virtual or hybrid. We have to look at our operational models. We have to look at government standards, influence those standards as we can, because we know that as consumer preferences change, technology changes, one of the last things to kind of fall along are some of those government standards. And so how can we have impact in making sure that there's alignment that frees us to fully utilize hybrid services? Training our workforce is key. The access to technology on part of our consumers. Do they have the right technology? Do they have smartphones? Do they have access to the internet? What can we do either to enable them to have that or to have a face-to-face option for those who don't? And this other bigger issue, and we talked about this, I think, in that first session on trends, this has broadened the competition. So I'm no longer, as a provider, limited by geography if I have a virtual option for service delivery. So I want to just quickly step through what are the steps. You will have this presentation. You can kind of dig down, look at these steps in more detail. But as you move into hybrid, it isn't just about taking your telehealth and having that as an alternative method for delivering services. It's about integrating it into your service. And so mapping out scheduling your access to care becomes important. Looking at your customer-facing referral and intake function and making sure that folks can access you virtually as well as face-to-face. Mapping out your changes in revenue cycle, because there will be changes in revenue cycle. It may have to do with rates. It may have to do how that billing coding works. It may even impact your collections procedure. Designing your go live that has performance indicators. How will you know that your hybrid approach is achieving what you want it to? Training and supervising your staff. Looking at your clinical operations and redesigning them around decision points of, is this better in face-to-face? Is this better delivered virtually? Mapping out changes needed to your technology infrastructure as well. How you're going to collect your data, what's your process going to be? The key question when you're mapping out access is identifying which consumers benefit most from or prefer to be seen face-to-face. And we do have some consumers who prefer that versus those who prefer virtual and or don't require face-to-face services. So that becomes the decision point as you begin to identify how to integrate your hybrid services. Finding the right technology, we've talked a lot about that in particular, but I think a key part of delivering hybrid services is having some centralized scheduling. Consumers need to be able to access clinicians through a centralized scheduling process. Most EHRs do support that now. You want to have integrated information, linking to clinician credentialing behind the scenes. That's why having that integrated HRIS system is important. And then even enabling consumers to understand their benefits and what they're going to need to pay in terms of co-payments. A key part of virtual and hybrid services is having 24/7 access, maybe implementing some on-demand initial screening, so I can go to the website, I can fill out a referral form, and maybe I can initially fill out some assessments that can go right to that clinician. So that self-service, customer-facing referral process. And then, enhancing the functionality overall, getting all that information in. We've talked about that as well. Mapping out our revenue cycle management also is so key. Where there need to be changes in billing, in coding, in how we get information out to consumers, how they can pay what they owe as well. And then using all of that to identify, are we able to now implement a new alternate payment method? And if that's the case, how can we integrate that in a way that we're driving the right outcomes? Performance indicators are important as well when we move to hybrid. We want to make sure we're looking at each of the main domains of performance indicators. And we'll look at this in more detail when we look at the issue of value-based contracting, having success with that. But you're really looking from the standpoint of the consumer. Is it convenient for them? Are they satisfied? Are they able to communicate? You're looking at quality and outcomes. Consumer safety. So if you have 24/7 accessibility, what are you doing with your technology to enable that to happen in a safe manner? Brand preference, because consumers have more choice. Efficiency, cost reduction, and then how does this impact our revenues? Training staff, making sure that they're familiar and capable working with the hybrid or telehealth services. This was big, and I've worked with providers that have had challenges in helping their clinicians understand how best to utilize the technology when they're providing a virtual service. So is your camera positioned right? Is your sound right? Do you have some mechanisms in place if you were to be cut off in the middle of a process? When we do a presentation like this, we have someone as backup who is also can manage if the production person has their internet cut off. I have protocols in place that if I were to lose internet, I could call in and we could have someone continue to move through the slides. And so you want that same type of redundant processes in case you lose internet and have issues with your technology. Process redesign of your clinical operations. You want to map things out all the way from referral through care to transfer and discharge. Identify those touch points for the consumer. And even though it's virtual, you want to make sure that it is consumer friendly, that it's efficient and useful for the consumer. The disaster plans, I gave an example of that just a moment ago. You want to have those in place. And then, making sure that you implement administrative changes as well to support this overall model. And the last area, as you move into this hybrid approach, make sure you get the right technology in place. Make sure staff have the right need, that both their needs for the right tools and their ability to participate is in place. We talk about more flexibility in terms of staff scheduling, maybe working from home periodically, so our staff set up with fast internet in a place that has no interruptions, where they can really focus and provide the best care. Recognizing the disparities in access to technology. So some folks that you serve may not have access to a smartphone. Are you going to provide smartphones? Are you going to provide a face-to-face option for those individuals? How are you going to work with that? And then determining what technologies are needed. Can you add some remote monitoring as well? You know, are there some apps that will support service delivery? And so this does require a re-engineering of services. It has the potential to grow our revenue, our geographic reach, our ability to connect with consumers as their preferred provider. And then let's just take a moment with the last few minutes that we have and talk about consumer engagement. In the bottom line with consumer engagement is, you know, individuals need to be empowered in order to influence their healthcare decisions, their behavioral healthcare decisions, their substance use treatment decisions. And so we want to be able to empower people so that it results in engagement. Key overall is that we want to be able to implement technology, whether that's by phone or text or email. We want to be able to align our referral process overall in a way that engages individuals and you know, helps them increase their ownership of their service delivery. There are a number of measures that we can use around engagement. You know, how long does it take for someone who reaches out to us to have their first appointment? Can we get folks in and have access within the first 5 days? Adherence to treatment. A number of organizations track how many folks complete their third scheduled appointment. Often folks will start with the first and the second, but by the time they get to that third appointment, they're dropping off. And so are they adhering to you know, that treatment plan overall? And if not, we need to dig in and understand why aren't they engaging. We look at no-shows. We look at all the data to understand how can we better provide engagement overall. And so technology helps us with that self-service piece. There are a number of technology options out there, all the way from diagnostics through treatment. You know, we think in terms of eCBT as a tool, or Beating the Blues as an organization out there that leverages the clinician as they provide services. It's something that can be on my cell phone that as a consumer, I'm able to utilize. And so across the treatment array, we're able to see some technologies that improve engagement overall. You know, one example is the Pair Reset, which, you know, for individuals who are using it, you know, it's a 90-day prescription, provides cognitive behavioral therapy support for substance use treatment. It does have a particular cost. A number of states have begun to include that cost in their Medicaid plan. And there's a return on investment. Actually, for the cost that's invested, there's been a reduction in emergency room visits and hospitalizations. And so the return on investment is positive. And you can see it's on my cell phone, and daily, it's as simple as me kind of identifying, how am I feeling today? You know, am I having cravings? How, you know, what are some of my triggers today? That data goes to the clinician and makes the clinician more effective. So overall, we're looking to leverage technology to provide engagement that's more personalized for the folks that we serve. We can better do care coordination. We can better deliver value using that technology. So overall, we're looking at opportunities to leverage the clinician and, you know, look for cutting edge opportunities. And so we're continually doing this ROI in terms of what we're investing in to provide that overall engagement. With that, we only have a couple minutes. I want to just check and see if there are any quick questions that we have. And no questions at this point in time. So with that, we only have a minute or so. Encourage you to take this information, look at it. I think organizations want to remain competitive, be the provider of choice moving into the future, are going to utilize technology to create that engagement to drive better results. So with that, I thank you for your participation today and look forward to you joining us for a next session where we really begin to look at the effective infrastructure for creating some value-based contracting. What goes into that? How can we be successful when we look at value-based care? So with that, I thank you and hope you have a great day.